What are the most common symptoms that hint at the possibility of heart valve disease, and what are the tests needed to confirm them?
Yeah. So this is again a very, very important question. At times, many patients come to us with a symptom of breathlessness. Now, breathlessness uh, can be an expression of this valvular heart disease. So it's very important to pick up this breathlessness and get oneself investigated whether all the valve functions and the heart function is fine, whether it is attributed to heart disease or valvular heart disease at an earlier stage. As I mentioned, many patients come to us that this breathlessness is happening for last 4 or 5 years, and we thought that it could be exercise incapacity or some anemia or some other things, but they do not get investigated from heart point of view, and this is a very awkward scenario, because at times if we don't do that, the heart disease becomes really advanced. So as you have asked, the symptoms of valvular dysfunction could be, the first symptom could be breathlessness, whether it is narrowing, whether it is stenosis, whether it is leakage. The first expression could be breathlessness. And initially, breathlessness happens on exertion only, but slowly as the disease advances, as there is more strain on the heart, the breathlessness starts to happen at rest also, and especially on lying down. So what happens on lying down? There is more strain to the heart chambers, and fluid tends to collect in lungs. So one tends to sit up for breath. So this is also a symptom of valvular dysfunctions. And the second symptom then comes is that there could be transient loss of consciousness. Patient may feel a lot of giddiness, or patient may lose transient consciousness if the main aortic valve, which is main exit valve, is shrunken. So this is specifically an expression of a shrunken valve. So breathlessness, loss of consciousness, or even the palpitations, fast palpitations, and the chest discomfort. So these are all symptoms of valvular dysfunctions. You also asked the second part of the question, that how do we get it diagnosed? Now, I think this is again very important to emphasize here, that it's a very, very simple test to diagnose the valvular dysfunction, that is a sheer echocardiography. Echocardiography is nothing but an ultrasound of the heart. It can clearly give us a picture of that whether any valve problems or valvular dysfunction is there or not.